Hi, Nurse Rob back here with Lesson 7, Transition to Home Care. Babies who have been prenatally exposed to opioids can be challenging for caregivers in the home environment. This lesson reviews 3 strategies for home caregivers of those babies prenatally exposed to opioids. The lesson will also review appropriate follow-up and resources available to caregivers in the home setting.
Discharge from the hospital is usually considered when infants with NAS are stable and signs of withdrawal have ceased. The infant should be eating appropriately, showing weight gain, and sleeping adequately.
Education for home care of infants experiencing NASH should begin during the hospital stay. If appropriate, a family-centered approach to education is important. Evidence has demonstrated that including mothers in the care of their infants with NAS has led to improved health outcomes for the infant. Decreases in the length of stay and need for pharmacologic treatment have been demonstrated when mothers play an active role in caring for their infants with NAS during hospitalization. Nurses and other healthcare providers who interact with this population should encourage parental participation in the care of infants with NAS. Education for home care should begin as soon as possible. A safe home environment is a must in order for the infant to go home with parents and/or a guardian. A safe sleep area that is low stimulus is crucial for these babies. During hospitalization, the caregiver must be taught and then demonstrate the skills of care, such as feeding, diapering, and assessing the infant. Caregivers are also given instructions on when to call for medical help. This would include signs of elevated temperature, irritability, and extreme jitterness, cyanosis, or cessation of breathing. If the baby requires medication at discharge, the caregiver has been taught and been able to safely administer the drugs on several occasions prior to discharge. These families are often at high risk and should have access to available resources as well as a clear plan for follow-up. Breastfeeding may help decrease the symptoms associated with NAS. Research has suggested that breastfeeding seems to help calm infants with NAS, possibly because of being skin to skin and the soothing environment that breastfeeding can provide. Breastfeeding recommendations will depend upon the status of the mother's substance use after delivery. Methadone and buprenorphine are found in breast milk, but in very small amounts. Usually women who are not taking substances, but who are participating in either a methadone or a buprenorphine program, should be encouraged to breastfeed. The decision for mothers of infants experiencing NAS to breastfeed should be discussed with the provider to be sure the benefits outweigh potential harm to the infant.
The long-term effects of infants exposed to substances prenatally are not clearly known. Questions remain as to the causes of the long-term effects being related to the actual prenatal drug exposure or to the home environment that the baby is discharged to. Possible effects seen over time in children with NAS include higher rates of repeat hospitalizations, trauma, and maltreatment, mental health disorders, behavioral issues, or lower intelligence quotient scores, IQs. These potential risks for negative outcomes for infants prenatally exposed to opioids highlights the need to encourage parents or guardians to provide a healthy and positive social environment that will encourage appropriate growth and development. Follow-up visits for the infant experiencing NAS should involve a detailed assessment of neurodevelopment, mental behavioral health, growth and development milestones, and health and home environment of the family unit. A follow-up plan should include visits to the primary health care providers for monitoring of medications if the baby were discharged on phenobarbital. Assessing growth as well as other motor and cognitive development at a primary care provider visit also allows for anticipatory guidance to caregivers. Referral to the appropriate community therapy service is highly suggested for these infants. early occupational therapy, or OT, physical therapy, or PT, or speech therapy can enhance the outcomes of these infants. Therapists can teach and encourage caregivers to continue therapy suggestions done daily in the home. The following clip from Marquette General emphasizes the use of therapy that began in the hospital and continues at discharge.
Early On program is the only program in the area that is not based on income. We base it on a child. We look at the child. We look at every area of the child's development. And if they qualify with a developmental delay, that's one way they can get services through our program. Another way is with an established condition. And one of the established conditions we have is toxic drug exposed. A lot of these little ones have issues with tone, which they tend to be kind of tight. So we do have physical therapy services that can go into the home and work with them on just functionally, how do we get these babies to loosen up. We have speech therapy, we have social work, physical therapy, occupational therapy services, and they can all go in the home and work with these infants.
In addition to my own struggles, staying clean, kicking the habits, I have the added stress of a high needs child, and it's been really difficult, and it's a continuous struggle. I'm so thankful for my physician and all the help that he provided me, the education and the support, and I'm especially thankful for the programs that were available for my child that really helped him in his early development stages. He's doing better every day. We continue to see improvement, and this program has just been wonderful, and it gives us hope for the future.
Probably the most
Teaching caregivers soothing techniques such as kangaroo or skin to skin, as well as swaddling, can make the transition to home easier. Teaching vertical rocking as a way to calm babies prenatally exposed will assist the caregiver with one more calming technique. Stressing that the baby have a calm home environment is another key to facilitating transition to home. A quiet sleep environment is key to the growth of babies prenatally exposed. Information such as that provided by the Texas State Department of Health, University of Texas San Antonio on this video can be very beneficial to caregivers.